Imagine being thousands of miles from civilization, trapped in a land of ice and unforgiving cold. Now, picture facing a life-threatening emergency with no one to turn to but yourself. In 1961, on the desolate expanse of Antarctica, a young Soviet doctor found himself in precisely this impossible predicament. This isn't just a story of survival. It's a testament to the iron will of the human spirit, a chilling narrative of courage, precision, and a self-inflicted act of desperation that defied all medical conventions. What you're about to hear is the true story of Dr. Leonid Rogozov and the surgery that changed medical history. Our story begins in the unforgiving landscape of Antarctica, 1961. The Sixth Soviet Antarctic Expedition had established Novolazarevskaya Station, a tiny outpost of humanity clinging to survival amidst endless blizzards and sub-zero temperatures. Among the crew was 27-year-old Dr. Leonid Rogozov, a brilliant general surgeon. His mission, to provide medical care for the 12 men stationed there. Little did he know, he would soon become his own most desperate patient, trapped in a realm where the nearest hospital was a world away, accessible only by a journey that was, for all intents and purposes, impossible. Dr. Rogozov was more than just a doctor. He was the solitary medical lifeline for his entire team. In this remote corner of the world, there were no other physicians, no emergency evacuation flights, and certainly no second opinions. The sheer weight of this responsibility rested heavily on his young shoulders. Every cough, every ache, every minor injury was his burden alone. His surgical skills were honed, his medical knowledge extensive, but nothing in his training could have prepared him for the terrifying twist of fate that was about to unfold, challenging him not just as a surgeon, but as a man. On April 29, 1961, a crushing realization dawned upon Dr. Rogozov. He began experiencing severe weakness, nausea, and excruciating pain in his lower right abdomen. As a surgeon, he knew the symptoms all too well. He performed a self-diagnosis, palpating his own inflamed abdomen. The grim conclusion was inescapable: acute appendicitis. An inflamed appendix, left untreated, would rupture, leading to peritonitis and a slow, agonizing death. The very condition he was trained to treat in others had now become his own, a cruel twist of irony in the most perilous place on Earth. Panic was not an option, but despair loomed. An urgent radio message was sent to Moscow, but the answer was grim. No aircraft could possibly reach Novolazarevskaya Station through the raging Antarctic blizzards. There was no ship, no rescue. He was hundreds of miles from any medical facility, trapped by a wall of ice and an unyielding storm. His life hung by a thread, and the only possible solution, the only path to survival, was an act of unimaginable courage and skill that had never been attempted under such circumstances: self-surgery. The clock was ticking, and time was running out. For a surgeon to operate on himself was, at the time, virtually unheard of and considered medically insane. Yet for Dr. Rogozov, it was the only option. He deliberated for hours, wrestling with the overwhelming risks. But the pain intensified, his fever rose. He knew the alternative was certain death. With unwavering resolve, he made the decision. He would perform his own appendectomy. His assistants would be the station commander and a meteorologist, men with no medical training beyond what he could instruct them, tasked with holding mirrors and instruments in the most crucial moments of his life. The next day, April 30th, 1961, a makeshift operating theater was prepared. It was a small room, lit by a single movable lamp and a mirror strategically placed to give him some visibility. The two assistants, one holding the mirror, the other passing instruments, watched with wide, terrified eyes. Rogozov himself administered a local anesthetic to his abdominal wall, carefully calibrating the dosage to ensure he remained conscious and able to direct. The procedure. Every tool was sterilized, every step meticulously planned. The air was thick with tension, dread, and a glimmer of desperate hope. At 2 a.m., the operation began. Rogozov made the first incision, a cut through his own skin, muscles, and peritoneum. The local anesthetic only dulled the sharpest pain, leaving him acutely aware of every sensation. He had to pause several times, weakened by the pain and nausea, struggling to maintain his focus. He provided constant verbal instructions to his assistants, guiding their every move, even as his vision was often obscured. It was a terrifying dance between conscious instruction and the primal instinct to recoil from his own suffering, a battle against his body and his mind. Working by touch more than sight, especially when the mirror fogged up, was agonizing. He eventually located the gangrenous appendix, inflamed and distended. This was the most critical moment. He had to tie off the blood vessels and detach the appendix without causing further damage, all while battling extreme weakness and the overwhelming urge to faint. The operation lasted nearly 2 hours. Every minute was a testament to his extraordinary courage and medical skill, a desperate race against the clock in his own failing body, with 2 terrified amateurs as his only hope. Finally, after what felt like an eternity, he successfully removed the diseased appendix. He then painstakingly sutured the layers of his abdomen. The operation was a success. Exhausted, covered in sweat and blood, he drifted into a much-needed sleep. Within 2 weeks, Rogozov had fully recovered and resumed his duties, tending to his fellow expedition members as if nothing had happened. His incredible feat resonated worldwide, becoming a legend of human resilience and medical ingenuity. He not only saved his own life, but provided an awe-inspiring example of what is possible when faced with the absolute extreme. Dr. Leonid Rogozov's story transcends the boundaries of medicine and mere survival. It stands as a powerful reminder of the indomitable human will, an incredible narrative of how one man, armed with skill and an iron resolve, confronted certain death in the most extreme environment imaginable. His self-surgery in Antarctica is not just a medical anomaly. It's an enduring symbol of courage, resourcefulness, and the profound capacity for self-preservation that lies within us all. It reminds us that even in the bleakest of circumstances, the spirit of humanity can achieve the truly impossible.